Hey guys, Jonathan here from Atlantic Integrative Medicine. So you're interested in semaglutide. Let's start with what is semaglutide. This is a compound version of Wegovy and Ozempic. You may be familiar with those commercial name brands. The medication we use is basically the same thing. It's just much more cost effective because we get it out of our compounding pharmacy. What exactly does semaglutide do? Well, it is a non-stimulant appetite suppressant. So it works by slowing down your digestive process so you get fuller faster, which decreases your portion size. It also decreases insulin resistance. It's going to help with those cravings, those hunger impulses. You won't get those frustrated, nagging cravings. You also don't have the desire to overeat, even though you know you're already full. So what success are we seeing with semaglutide? Well, it's actually doing really well. Research has shown that in individuals using semaglutide, they're experiencing a total body weight decrease about 15 to 20% of their weight in an average of 6 months. So this medication is extremely effective with that kind of reduction. The next question that we often get from individuals is, well, is this a safe medication? And the answer to that is, yeah, it's a very safe weight loss medication. It's probably the best medication that's come onto the market in several years. It's the first FDA-approved weight loss drug in the last 12 or 15 years that doesn't have the cardiovascular risks associated with it, maybe like phentermine. So you're not going to experience the side effects that you would with that kind of medication. Also, it doesn't really have any major contraindications, and to our knowledge, there's no long-term side effects. So again, extremely safe medication. Really excited about this type of approach. So what does getting started on semaglutide look like with us? Well, we start all of our semaglutide patients off on an 8-week protocol. Okay, so we do this because you got to start off at a very small, low dose of the medication, and then you're going to increase slowly over time. This allows your body to adjust the medication, to acclimate the way it feels, and to get rid of any sort of side effects you might experience, most common being nausea. So we will try and mitigate that as much as possible. So in addition to the medication that you get through that 8 weeks, we provide you with an 8-week supply of vitamin B12. That's helpful for getting rid of the nausea and helping you acclimate to the medication. So this should help with that and significantly reduce that. This in and of itself is a $400 value. We include that in your program with you. In addition to B12, we're going to provide you with a comprehensive set of labs to look at your entire body's physiology. We want to leave no stones unturned, so we're going to run a super in-depth hormone panel. We're going to look at the full thyroid panel, check a couple of your essential vitamins. That lab panel in itself is a $2,000 value. We include that with you along with a consultation with our medical provider to go over your labs and give you an insight to what's going on with your body. So I hope this gave you some good information about semaglutide, how it can help you, and how we leave no stones unturned in the office. If you have any questions, reach out to us. We look forward to seeing you soon. Thanks.